Thinking about robotic knee replacement surgery, let me help you guide so that you can tick all the right check boxes in order to pick the right surgeon for your robotic surgery. Hello everyone, I am Dr.Suhas Masilamani, a fellowship-trained hip and knee replacement surgeon with expertise in robotic surgery. It is very important for you as a patient or as a relative in order to pick the right surgeon, the right technology, and the right implant so that you have an excellent result after a knee replacement surgery. These are the three things that I would look for when I decide as to who will be the surgeon who will operate on my mother, father, or my friend. First is the expertise of the surgeon. It is very important that you pick a surgeon who is very proficient in robotic technology. So the questions that you need to ask your surgeon is, how many years has he been doing this particular surgery? What are his numbers? And how often does he do this particular surgery? It is also important to know what are the advantages and disadvantages of using this particular system. Second important feature is you should always pick a robotic system which has a proven track record and has been there in the market for many years. So the questions that you need to ask or find out is, how old is this technology? How proven is this technology? And what is the evidence backing this particular robotic system? Usually you should pick a system that has been there for quite some time and has proved itself not only in India but many other countries. The third most important thing is what type of implant is being used, because it is important for you to know that finally it is the implant that needs to survive in your knee for 15-20 years. So always ask the surgeon what is the type of implant, how new is it, or has it been in the market for many years. For example, the robotic system that I use has been on the market for at least 15 years. It has an excellent track record and has a lot of evidence backing the results from that particular robotic system. Similarly, the implant that I use has been in the market for more than 20-25 years with excellent survivorship in many registries across the world. So once you know what is the proficiency level of the surgeon, what is the type of technology he's using to do the surgery, and what is the type of implant that he's using, I think you will make a very informed decision in order to pick the right surgeon for your robotic surgery. For any further queries, please leave a question or a comment in the section below so that I'll be able to answer at the earliest. Thank you so much.